Well, what I wanted to do with Harborside Health Center is create a facility for patients where they could come and begin to heal from some of the shame, from some of the stigma that patients have internalized over the years from having to hide their cannabis use from their family, from their employers, from their neighbors. And so I wanted to create an environment where people could come who would feel completely normal, that would feel respectable. There's nothing shady or dangerous or even unusual about the activity of coming and buying your cannabis. And so everything you see in Harborside Health Center reflects that commitment. The fact that we bring in light wherever we can. We have beautiful plants growing. We have professional fixtures, and we have natural fiber carpeting to evoke a feeling of natural elegance and friendliness and healing environment. Harborside Health Center is a not-for-profit community service organization. Like other businesses, we do turn a profit, but any of the net retained earnings that we have, instead of going to shareholders or owners, instead are circulated back to the community in the form of patient services and charitable donations. So we have many different services that are funded this way. One of them is our holistic care clinic, which is open 7 days a week and offers a range of therapies, including acupuncture, chiropractic, herbalism, naturopathy, and a number of other therapies. We also have a care package program for low-income patients. 600 patients a week take advantage of this program, which has tripled in size since the recession deepened. Each patient shows us some evidence that they're on a low limited income, like a letter from Social Security or unemployment, and we put them on the program, which entitles them to a free 1.5 grams of mid-grade medicine worth about $20 once a week. So, and we're distributing, about $12,000 worth of cannabis a week in that program, $50,000 a month, over $500,000 a year worth of free medicine to low-income patients in the Bay Area. We also couple that program with another program called the Patient Activist Resource Center. The Patient Activist Resource Center is where we teach and encourage patients to become activists, to stand up for their rights and for the rights of other patients. So patients will come in, they'll provide us their address, and then we give them contact information for their elected representatives, for letters to the editor, for federal prisoners who are in prison on cannabis charges. And then they spend an hour on the phone or on the computer or even writing out by hand letters and lobbying, and at the end of that hour we give them a free gram of medicine. So between the two programs, the care package program and the Patient Activist Resource Center, no patient ever comes to Harborside Health Center needing medicine and leaving without it because they don't have enough money. There's always a way for people to get the medicine that they need. We recently added a new program, our Substance Misuse and Abuse Clinic. This was created in response to a survey that we did of our patients. We found that 15% of our patients did have issues with substances that they wanted assistance with. The substances in the order of need were first tobacco, second alcohol, third pharmaceuticals, fourth other street drugs, and we even had a couple patients who wanted some assistance with their use of cannabis. So we've now developed an intake program with a trained addiction treatment specialist who conducts an initial interview with each patient and determines whether or not that patient is in acute need. If they're in acute need of services that we cannot provide them, we refer them to a network of cannabis-friendly treatment specialists we've developed. If it's not an acute case and we wouldn't be placing them in danger by a lack of referral, we then introduce 5 or 6 different support groups that we have that are specifically tailored for a variety of different problems. Another one of the innovative services that we've introduced at Harborside about a year ago was our analytical laboratory testing program. In December of 2009, Harborside became the first, and I think to date the only dispensary in the state of California that is sending all of its medicine to an analytical laboratory for safety screening and potency quantification. So when patients come and select medicine here, they know what its strength is and they can be confident that it has no dangerous contaminants in it. So Taking care of our patients begins with taking care of our employees, of taking care of our staff. Our entry-level retail workers start at $14 an hour. After 30 days, they are increased to $15 an hour, and generally within a year or 2 years, they go up to $17 or $18 an hour. In addition to that, all of our staff receives health insurance. All of our staff is eligible to participate in our 401k retirement program, which gives employees 4.5% matching funds for their savings. Our staff all has paid time off, and they get a free gram of medicine for each shift that they work, and they have access to the full range of therapeutic services that Harborside Health Center provides. So we really believe that taking care of our patients begins with taking care of our people. There's not going to be anybody to take care of our patients if we don't take good care of our people. We also are firmly committed to being contributing members of the greater Oakland community and are committed to maintaining positive relationships with the entire community, starting with our most immediate neighbors in the neighborhood and working outwards all the way through and up to our council persons and our mayor. We have had a great relationship with the city of Oakland and try to contribute when we see some need. So one of the charitable contributions that we made last year was to the family of one of the 4 Oakland police officers who got murdered. You may have heard about this, that 4 of our officers got murdered in a tragic incident. So one of the officers' family didn't have a lot of money, and they were unable to come out from Ohio for the officers' memorial service. So we donated $5,000 to fly them out here and put them up in a nice hotel so that they could say goodbye to their loved one in a good way. We also, this year in Oakland, we faced, like many municipalities in the country, a severe budget shortfall, and the city had to consider closing some of our most beloved institutions like the Chabot Space Center or Children's Hospital. When we realized what was going on, we took a look at the amount of money that we were taking in and tried to figure out whether or not there was some way that we could help the city. And because we're a not-for-profit community service organization, we took a look at our books and saw that indeed we could afford to do a bit more. So we went to the city council and we requested that they impose a 1.8% gross receipts tax on Oakland dispensaries. That measure went on the ballot and was overwhelmingly approved by Oakland voters in our last election in July. And so now, as of January of this year, all Oakland dispensaries are paying 1.8% of their gross revenue to the city, directly to the city of Oakland, and that will be, probably over $1 million in the first year. We have developed a very good relationship with the Oakland Police Department. When we first opened, there were a few officers who hadn't quite got the message, who started pulling over some of our patients and harassing them. We got in touch immediately with the command structure of the Oakland Police Department and explained the problem to them. They very, very quickly took action, and the problem officers were transferred out of our district. So the Oakland Police Department, I think, has really come to understand that medical cannabis is a benefit to law enforcement. It allows law enforcement to concentrate on crimes that really threaten people and threaten property, and it doesn't require them to spend their time chasing after people who are just trying to address their illnesses. So Harborside is dedicated to providing a large selection of cannabis medicines to our patients. We believe that there's many different kinds of patients, and that patients should be able to have a full range of selection of the different forms and the different varieties of cannabis so they can find the one that most effectively treats their